Good morning, Dr. Rivi.
Hello to everyone.
It's
So nice to be here.
and so wonderful to have you, and welcome to all your community and everybody who's here on this call to have a little bit of a talk with Dr. Rivi and about her book, Moving Pain Away, which is a noble pursuit, Dr. Rivi.
Thank you.
Mm. You have given absolutely years of your life to your patients, to your clients, to teaching, to writing, to investigating, to learning, and it's culminated in this beautiful book that you've now, well, it's a while since you produced it. What year did you produce this book?
2017.
2017. Okay, so it's almost a decade old. Yeah.
Yeah.
But for me anyway, it was a new experience to read it, and it's just so lovingly created. It's really quite something. I like its size too. It's little, so you feel like, oh, I can do this. But when you open up, it's full of interest and lots of scientific background, and you have to think your way through it. But the jewels in that book are quite something, and I hope that everybody starts to understand your method, which is quite unique, very unique. I think one of the things about our field, because Soul Advisor supports 168 different therapies, is the way that people walk through their life and they learn this modality and that modality, and then within them they synthesize and embody a way of bringing healing to the world, and that's what you've done. So it would be wonderful for all of us if you could, and I'm sure that many of you who've seen Dr. Rivi before might know her work, but some of us don't, and so perhaps you could explain a little bit about your work, what you do.
Okay. I will try to summarize it in few things. Since I'm coming from a physical therapy, conventional background, I always felt that I cannot only treat the body, the physical body. When I started more than 42 years ago, and I put my hands on patients, people start crying and talking about many, many things that were deep inside them. And I felt that I don't have the tools to deal with it as a psychotherapist. And at that time, I was a physical therapist. And this was in the 1980s. And at that time, body mind work and meditation and all those things were not very prominent. And I start looking around and checking and took hundreds of courses in different um, university and out of the universities and study graduate level psychology level and then continue with dance movement therapy. And when I graduated from dance movement therapy in 1991, I realized that still I don't know exactly how to treat chronic pain to the point that I'm satisfied with it. It's not that I dismissed or did not like what I did with my hands. I love my work with my hands, which is for me like working like a sculptor, going one area at a time, checking what's going on, and fully respecting what I feel with palpation, with gentle palpation. But I felt it's not enough because people with chronic pain sometimes were helped and sometimes were not helped. And then it led me to the PhD where I combine dance movement therapy with music that has some meaning to the person and a lot of guided imagery that I studied with Dr. Catherine Schoenberg and other people for many, many years. So I start putting it together. And when people came to see me, they start saying to me, you help me, they help me, but I feel like there is more that I need to explore. And it's deep inside me.
Mhm. Mhm.
And this is what I wanted to talk about when I'll do the PowerPoint presentation with you. What's going on inside the body is not the joints only, or the muscle, or the tendons. It's the way we envision ourselves from inside
Yeah.
and what we experience from inside and from outside us. So
Mm.
it's much more complex.
Yes, it's so much more complex, Rivi. And you know what I love is the embodiment of that complexity in the incredible drawings that you've chosen to illustrate your book. And because once you look at the complexity of the human body and the expression, the emotional expression in the movement of those beautiful, beautiful diagrams, it brings you back to a reverence, doesn't it, almost, for the human form, mind, body, spirit complex. And that's what I love about your work, that you've taken physiotherapy, sorry, we call it physiotherapy in Australia, physical
Yeah.
therapy, and you've
Uh,
extended, you've helped to bring back that gorgeous emotional expression that dance is, and that you've understood that it comes from, moving into complex forms. The healing is the beauty, and the beauty is the healing. So I'd love you to just talk about, I don't know how you would like to do this, but let's just ask a few more questions about your book, and then we'll move into some readings from that book. So you with what you've done, with what you've put down, what was your full intention behind that book? If you could have said, this book will land in this way in the world, what would that have been?
um, that people with chronic pain or musculoskeletal disorders, such as back pain, neck pain, shoulder pain, will understand that there is a way of treating the body that is not physical. And if you had been treated physically, mechanically, you always have to look inside and see what's going on. So if your upper body is very weak or afraid or frustrated or concerned, it can manifest itself in the neck, in the shoulders, in the back, everywhere else. So always to put together the emotional aspect and what's going on inside and outside in the world, penetrate inside the body, situated inside, and there are so many things inside you that you're either conscious to it or subconscious. It happens. Most of the time, we're not aware of it.
Mm,
So in the example that I'm going to share in a minute, I chose simple two case studies that I think will illustrate very, very well how people who came to me and went to many physical therapists and doctors, MDs and orthopedic doctors and injections and different things were either not helped or helped partially. And what I was open to offer, and of course, it took time to go deeper into what's going on inside them. And they were open to it. If you're not open to working with guided imagery and meditation, and sometimes music, sometimes dance, it won't work. You have to be open to it, of course.
yeah, yeah. Absolutely. That's the starting point, isn't it? But I think that if you're experiencing pain, all of us have had pain at some stage, then you'll do anything that you think might help. And it's so frustrating for so many people who have pain to try to get to the bottom of it, because that's what we need to do, isn't it? It's a complicated thing, experiencing pain. So I think, it would be great to maybe move straight to the case studies, because it will give us more understanding, and we can keep talking. We'll provide time towards the end of your presentation for everybody to chime in with questions. So please do, everybody, but a little bit later. Yeah. Would you like to perhaps present your case studies?
Sure. So I'll go to share.
Yes.
Give me a minute. Where is it?
Right down the bottom, there's a big green button.
Yeah, but I did not open it on my screen yet.
I'm sure all of us can relate to this. It's so tricky, isn't it, working on a Zoom? So,
Yes, and I'm afraid to close you all. Let me just open the PowerPoint presentation.
uh, and yes, it's very, very nice to have everybody here, especially from the US. I haven't traveled over that way for such a long time. We had a presentation yesterday with a beautiful man who's from New York. He's a presenter. He's been presenting for 50 years. So he was here presenting to a local Cambodian team at Anchor Grace. Anchor Grace is a gorgeous five-star hotel, and it's becoming the hub of traditional, complementary, integrative healthcare in the world. So he came and presented to a Cambodian team yesterday from New York. It was quite something, a real interesting mix of cultures, Asian and New York culture. Wow. How are you
Beautiful.
going? Did you find it?
Yes, do you see it? I'm sharing it.
No, not yet, but you can just press share down the bottom and then you should be able to.
1 minute. Sorry for the delay. Okay, here it comes. Share.
Well done.
Okay.
All right. Lovely. Thank you.
Okay. So I try to make it as simple as possible, and I thought giving examples will be the best way of talking about it because it's hard to understand exactly how it goes. It took me many years to understand what I'm doing.
Mm.
So basically, I'm integrating therapeutic exercises via dance movement therapy, guided imagery, and mindfulness into the treatment of pain. And the person who helped me to draw these beautiful things on my book is a great artist in Israel. His name is Ziv Lenzner, and I thank you so much for this. So basically, what am I doing? I am having the option of either using one method or combine different methods. So if we go to the third one, physical therapy, I assume most of you are familiar with physical therapy. I use a lot of hands-on work. I don't use too much machines, but for me, working with the body is like a sculpture, trying really slowly, slowly to align and feel the body. And then I can combine with, if the person is ready for it, 1 second, guided imagery, which is basically, let me just move this down. For some reason, give me a minute. I'm trying to move so I can see the full screen, and for some reason, the pictures on the right hinder the content.
Oh, I always wish I was in the same room.
Okay. So basically, guided imagery is a technique by which the participant attempt to make beneficial physical changes by repeatedly visualizing the sensation associated with the experience. It promotes relaxation and well-being. It helps to reduce stress, anxiety, release pain, improve sleep quality, and much, much more. So this is one way that I'm working with the person is ready for it. And then the third method that I use is the dance movement therapy, which is a form of intervention that uses dance and movement as the main therapy in which you further the emotional and physical integration of the individual. So you can be into the state of catharsis, just enjoying the music, improving your self-esteem, body image, communication, coping mechanism, reduce stress, and so many more. Now, when a person comes into my office, I look at them in general. What do I see there? And when I see the person, I'm looking at what does the body tells me? Is this person just coming because of neck pain, shoulder pain, back pain, or something is inside them? Am I tired? Did I lose hope in this life? Am I confused? What am I trying to gather? Am I sad? So I try to gather those things and put it in the back of my mind and then relate to it. So the main thing that I'm working with is taking the event and the interaction that the person is describing to me. For instance, my mom is not treating me well, not talking to me, and I feel that my chest is being contracted again and again and again. It's hard for me to breathe. So I take the event or the interaction. What do you feel and what do you sense? What do you feel in terms of your sensation, of feelings, emotions? I feel smaller. I feel more afraid. I feel more anxious. What does this event with a person causes me? And what is the sensation? I feel more tingling. I feel more numbness. I feel more muscle spasm. So I'm going now to tell you briefly about a case study. And I call this gentleman Mr. Che. He came to me, a 35 years old male, an attorney, demanding in a stressful position, chronic neck pain with stiffness, multiple past treatment, medication, conventional PT, steroid injections, so many orthopedic doctors and so on. And when I saw him, okay, I'm trying. Can you see the man in the picture?
Yes, we can.
How can I move you that it won't, and it's not being hindered by your pictures, but by your frames?
No, not at all. That's beautiful. Yeah.
Good. Okay, so I'm going to read you briefly about him, and then you get to know him, and then you see what I'm doing with him. But if you look at the picture, I just want to give you one clue for now. This gentleman never felt his neck. He has no awareness of his neck.
Mhm.
Che was a pleasant professional, 38 years old man residing in New York with hectic work schedule and a high pressure job. He came to me complaining of severe chronic neck and upper back pain and stiffness that had lasted more than a year. He thought therapy for his neck from various medical doctors and physical therapists, but to no avail. The pain level had dropped a bit, but was still a big hindrance to his everyday life functioning. We started therapy with conventional, what I call physical therapy, technique, joint and soft tissue mobilization, along with the prescribed home program exercises. Although he was extremely busy and under a lot of pressure at work, he was eager to improve. A physical evaluation revealed neck range of motion, limitations, severe muscle stiffness, and hypersensitivity to gentle touch. The pain radiated from the back and sides of the neck down to the shoulders on both sides and upper back. Following 2 months of conventional physical therapy approach, Che described that he was improving minimally in terms of having less pain in the back of his neck. However, the stiffness in the affected area persisted. This was the stage that I realized that I have to do much more for him. So this is briefly about what I described.
Mhm.
So the goal with him was enhance chest awareness. You can see that he has beams inside his rib cage, and this is what he described to me when we did a guided imagery exercise with deep meditation. He said, I feel beams stuck inside my chest, and I cannot feel the connection between my body and my head.
Wow.
Now we're talking about a very rational person, very successful lawyer, somebody who is not psychotic and he knows more or less his body. So my goal was to enhance Che's awareness of the connection between his neck condition and his tense lifestyle. I gave him an exercise, allow yourself to feel and sense your body, starting from the feet and going up all the way to the top of your head. Then check if you are aware of all your body parts. Are all your body parts connected to each other? Che described that he experienced his body as calm, but his head is like a stormy, windy blur. He further described imagining a tunnel from his mid-chest area up to the lower part of his neck. The head and the chest felt separated from each other. So we continued, and I taught him, after we did physical therapy, which all of you know what is physical therapy, all the regular exercise for the chest and for the neck and for the shoulders, we went inside the body and we start with images to imagine the body expand forward. Imagine the body expand to the side in imagination, not physical exercise. imagine his body going backward. So this was the three things that we started feeling. And then we wanted to check what is happening to him inside his tunnel, the tunnel that I showed you before. Okay. So my goal was for him to start feeling the neck, feeling less tight inside his body, and being able to breathe without an effort. And then we proceeded to do a few other things which were very, very important for him. As we progress in the therapy, I asked him to evaluate and observe what happened to him when he encounters with different people. So what I'm trying to say here that when we encounter with particular situations or event or people, something evolve in the body, something change in the chest, in the heart, in the shoulders. And so I asked him what happened. For example, when speaking with Susie, this is Susie, his good friend, Chad described his chest expanding to both sides as the amount of tension he felt decreased. However, when he spoke to Christopher, a co-worker who was hard to deal with, Chad felt his chest contracted in pain while having a hard time breathing. So this is something that he never did in his life. And I said, you're working, you have to cope with people, you have to be able to enter the room, not contract, not be in pain, being able to continue to breathe and talk and do your work. So what we did many things in guided imagery and meditation, but what I'm going to show you is one exercise that we did with him, which was imagine shield of light around your chest and allow the golden shield to surround the entire chest when you need it. And what I thought of doing now, we're going to do a little exercise with all of you. For a few minutes, I want you just to screen your body together, feel your body, and see what we can do to help blockages, whether in the chest or in different body part. So why won't you sit back and relax and close your eyes? And just enjoy this short exercise just to give you a very taste of what I have been doing with him and with others. Feel your feet on the ground. Make sure that you're in a safe place, no noises around. And start breathing in and out, inhaling through nose, exhaling through pursed lips.
Meditation.
And please mute your phones or your computers. And just concentrate on inhaling through nose, exhaling through pursed lips. Imagine inhaling light and oxygen and nutrition from far away from the universe. It goes into your body, nourish your body, spread into your body, and you're going to exhale out of your body all the fears, concerns, anxieties to the best of your abilities. Whatever you can do, just do it easily. Don't push anything. And I'm giving just instructions and you develop it the way it works and is right for you. You're going now to feel your feet on the ground. Feel the right foot, the left foot. And very slowly, you're going to scan your body, starting from the bottom up, like you're traveling inside your body with patience and with love. And check your legs. Do you feel your legs? Do you feel your hips? Do you feel your abdominal cavity, your pelvis, your diaphragmatic muscle, your chest, your shoulders, your neck, all the way to the top of your head? And as you scan your body, you just ask yourself, am I feeling my body? Is there anything inside that I see that makes me feel uncomfortable? Any image, any tightness, different color, different temperature? Just scan your body and check what you see inside. Don't work with your head. We're just sensing and feeling and being aware of the inside of the body. Slowly, slowly breathe out. And if you encounter with something that is a bit more contracted or blocked or tight or full of fear, or full of concern, just ask yourself, where is it in my body? You don't have to know the anatomy. And you're going to take your right hand and place it on the area. You're going to take your palm, your hand, physically, place it on the area if you can. And slowly, slowly, we are going to connect to the source above us, to the universe. And healing light is coming down toward us to nourish the area that is sensitive or painful or vulnerable. Just imagine, if you can, no pushing, whatever comes easily. Healing light from above, from the source, is coming down toward the vulnerable area and take care of the area with gentle motions. Clean the area, align the area, purify the area, and send all the residual parts that you do not want to carry inside away from your system, away from your physical and emotional body. Just indulge yourself with this source of light. You can also imagine a head of a shower or a sun that send you this beautiful healing light to take care of you with love, compassion, and a lot of healing light. And slowly, slowly, we are coming back to the here and now, to the physical body. Feel your legs, your feet on the ground, your belly, your chest, your neck, your head. And whenever you're ready, breathe out 3 times and open your eyes when you're ready. Whenever you're back with me, let me know. I had to make it short because I know that our time is short. Usually it's much longer, and it takes time to get into it. But since I wanted to deliver some more things and share with you some more things, I cut it a little bit short. So let's go back. And before we go back, just remember that the end after the session, usually I say, people write what you experience if we don't have time to share today. Okay, so I'm going back to Che. After working with him for a few months, he started feeling his neck. You can see his neck is there. His tunnel widens and he started feeling himself. He started feeling his chest. He felt more present. He opened his chest when he met people. He didn't collapse into his chest. He started feeling himself so much more than ever before. So we proceeded one more step that I wanted to share with you to what happened to him at certain point when he was using the elevator in his office. So the goal was to enhance Che's presence by taking up more space. One of the things that he told me, I'm a lawyer, I'm talking with people, I have so many people in the room, I don't feel that I take space. So how can I continue to work with that? So, so Judith, if you can mute your phone, it will be wonderful because we can hear people in the room. Thank you. So the exercise was, I guided Chet to imagine taking elevator up to his office and checking out how much space he imagined occupying inside the elevator. And as you see, he said to me, I can barely see myself inside the elevator. I feel as though I'm almost not there. I possibly estimate occupying a square foot of the space, which was just unbelievable how a person who needs to do something so presentative and so demanding feel this way. So we worked on his body image, on taking more space, and I told him this was one example. Now imagine entering an elevator in a building where you reside. One second. So look at the big difference between the way that he described to me where he reside and where he was in his office. So this is briefly about Che case study. There is many, many more details here. I try to make it as brief as possible. We follow up with Che a year after and 2 years after, and he was doing very, very well. So this was what happened with Che. So as I mentioned to you before, we are looking at the event and the interaction, the feeling and the sensation, and I'm going to dive into the second case study. If I have more time, Kate, do I have?
Yes, we've got until 4:45, so we've got about a, yes, we do. We've got
Oh,
11 minutes
wonderful.
or so.
Okay.
Yeah.
So I'm talking, this is a lady who came to me, a young lady. Her name is Betty, and I'll read you briefly about her, and then we'll go to see what I've done with her. I met Betty, 23 years old, when she was referred to me with a diagnosis of shoulder and neck pain for the prior 6 months. When she entered the room, I saw a smiling young woman with a pleasant demeanor. She was pursuing a bachelor degree in art, played the guitar, and performed as a singer. When I asked about her family, she described her parents who still lived together but had been emotionally separated from each other for many years. Her father frequently belittled her mother and her. My father was mean to my mother and mean to me. Betty told me that since she was a child, she had been disassociated from her body because, this is her, because her father mistreated her. So what happened? He mistreated her for many, many years. So we are talking about a mini trauma that repeated itself again and again and again. She continued to function, but she was so scared of him, and her body felt it in so many ways. Her father would scream and yell at her until she cried, so she taught herself how to dissociate herself from her body. This is her with the father. This is her singing. In her initial stage of therapy, Betty and I had two main goals in mind: to help her with the shoulder pain and to increase her ability to feel and sense her body. Once the shoulder got better in terms of increased range of motion and decreased pain, I shifted my goal and concentrated more on the entire person. My idea was to help Betty increase her awareness of her experiences of bodily tension, frustration, fear, and resentment that had took place for so many years. So in order to enhance her body awareness to various emotion and sensation, I gave her the following. Try to notice the sensation of your body, starting from your feet, working your way up. How do the different parts of your body feel physically? Tension, tingling, contraction, what's going on? Betty said, my chest is like a ball and there is a large black stain in the chest going up to my throat. So I was like in shock because I never heard this strong image being presented to me, but I fully respected it, what she said. And then we did a lot of different things that I'm not going to go into right now, but what I wanted to show you, this is her standing between her parents. She felt her spine is getting weaker and weaker. She described to me so vividly how she feels like she's going to lose her spine, lose her center, lose her balance because of what was going inside her family. She was in the middle, describing to me so vividly what's happening in her body. She said, Betty described that her spine was awkward and weak. The temperature inside her body was warm and her body did not feel intact. I feel only a slight connection between my muscles and tendons to the spine. And then we continued after we to a different situation. I gave her a group of friends that she likes. When I sided with my favorite group of people, my body was calmer and more expanded in the chest area. So this is with more kind people, with easy people. When I was with my ones whom I disagree with, my body was tighter, tenser, my chest was narrower, and it was harder for me to breathe. So I implemented many, many exercises. I know that we don't have the time to go into all of them right now, but one of the things that I do with many patients of mine who feel that they're losing it or lacking balance or the spine is not strong enough to hold them, we start developing roots from the heels. And if I had more time, I would experiment it with you, but I understand we don't have. But this is one exercise. And a side note, I know it's very hard to do guided imagery by yourself. Most of my patients prefer to do it with me. And then sometimes I record specific exercise for them to do by themselves, but it's not easy for many people.
You have a beautiful voice to get us through.
Thank you. So then after the guided imagery with the developing of the roots and she felt more stable, and then we did a lot of music. We took the music that has some meaning for her and she started dancing and she loved it. And the last thing that I'll have to share with you for today is the way she developed to be who she is right now, a very successful psychotherapist. I was practicing with her the regal pose. Notice your emotions and physical sensation as if you were a queen wearing the appropriate attire, using queenly manners and feeling like royalty. Repeat doing so throughout the entire day. So slowly, slowly, she was able to feel better with herself. She lost 40 pounds. Now, I cannot claim that I did it. I know one thing, I helped her to feel better. And she became a very, very wonderful psychotherapist. And I'm very excited to say that she's using part of the exercise that we've done together.
What a beautiful story. It, it's really quite amazing that you're able to tap into a person's innate capacity for healing and coming back to their sense of well-being that they're born with, isn't it? It's like magic, Rivi.
I'm doing whatever is right for me. And I came to this because as a very vulnerable and sensitive human being, I felt everything and I still feel everything on a body level. I
Mm.
feel like I have an imprint inside me each and every time somebody scream or somebody do something that is not easy around the world or in person. And this imprint goes inside my body. I feel it on a body level. It can be in the jaws, it can be in the neck, it can be in my heart. And I respect it. And then I said, I don't want to become an imprinted, embedded, small, tense human being. I want to stay expanded and open and royal. So
Mm.
this is work of years that I'm still experiencing.
Mm.
And I believe that we have to exercise this way, the way we exercise in many things.
Mm. Oh, thank you so much. What a beautiful beautiful explanation and description of what it's all about, really. I wonder if that's something that we should all take out into the day, being the queen.
For
What do you
sure, for sure.
the most beautiful visualization, isn't it? And you're right, because it's a holy thing being born into this planet between heaven and earth, and so many things crumple our form and twist us round. And so it's lovely that you've developed such a strong technique for working with people with such success. Really great. I wonder if anybody has questions or ideas that they'd like to bring forward. We've probably got about another 5 minutes here, so please feel free to ask Rivi anything.
Hi, can you guys hear me?
Yes, hi, Sigal. So
Hi,
nice to
hi.
see you.
Yeah, no, this is lovely. This was really good. I don't have a question. I just wanted to say comment and thank you so much. It was lovely. And I know Rivi from choir, and she's amazing. Her presence is so amazing, and she's always helping us with this הסדנה. איך
Workshop.
אומרים את זה באנגלית? Yeah, with the
Workshop.
workshop. Yeah,
I'm
yeah,
leading
yeah.
a workshop.
So I wasn't surprised with everything that I just heard here, just from knowing you. And yeah, I'd like to implement more of these methods and work more with you when possible. So thank you.
Beautiful. I wonder, Rivi, if you wanted to stop sharing now so we can see you when we're talking.
Oh, sure.
Yeah.
Okay. Oh, okay.
Hello.
Hello. Hi, Terry.
Hi, Rivi.
Yeah. So I feel like I have so much more to say, but stop me if we are running out of time and if anybody wants to talk. But it is so imperative to work on expansion of the inner body and the soul on a daily basis. Nobody will do it for us.
Mm.
And doing it, there are so many ways of doing it. With the music that I sing with Sigal, the music comes like light inside me, opens me. So I know what does it to me. I know that talking with particular friends open my chest and releases things. So we have to make a list of things that open our present and brings our level of energy and hope and love higher and higher and higher. And we have to keep on doing it on a regular basis because no one will do it for us.
It's true. Daily practice.
No one on this earth.
Daily practice, and it's such an important thing. Thank you for saying that, because it's one thing to go for therapy or be treated or have that, but it's the daily practice, that the daily doing of who we are, on a higher level, that actually strengthens our form so that we can share that healing out with everybody else. Yeah. Because even I love your example of the cha in the lift, and he's so small. And of course, when he's that small, nobody's feeling him. And when he's big, people do, because we react to electromagnetic fields. So, yeah. Dr. Rivi, you're amazing. Thank you very, very much for being.
Thank you so much for being here. Everyone here is so important to me. I can see your names or pictures, and I'm so happy to meet Pascal, if I said your name correctly. And thank you so much for being here.
And Martine, too, who you haven't met
Oh,
before.
Martine. Hi, Martine. Sorry. Yes.
All part of the same.
You are an inspiration, Rivi. You are an inspiration.
Oh, תודה, חנלה. תודה.
It's not only your method, it's also your voice. You can feel it in your voice, which is very calming. And I think it helps to, at least I feel it. It helps really to connect with you and to do all the exercises that you are practicing with your patients.
And wait until you hear her sing. You'll be like flying.
Okay, thank you, Sigal. Next time we're going to get her to sing. Oh, you and Pascal are in the.
She is an amazing singer.
And I
Okay,
think
next time we'll do a singing lesson.
multi talents queen.
Well, thank you so much. And Sigal and Pascal, you're coming from the same place, which is very pertinent to you can see you're both out there in the universe. And thank you so much for bringing that healing quality into all of our bodies, Rivi, to connect us with all that is available all the time for all of us. And and remind us of that. So bless you, and thank you everybody for coming. It was really beautiful to feel Rivi's community around her. It really was. So warm and gorgeous. Anything you would like to say to end, Dr. Rivi?
Oh, I feel very blessed that we are doing it. And I forgot to mention that I'm doing blessing at the end of each and every session, counting the blessing every day with each person and with myself. So I'm blessed having you, and I hope to continue for many, many more years to help whomever I can help.
And I hope to be able to help you to help by letting the world know that you exist. And thank you again. Thank you so, so much.
Thank you.